Hello, everyone. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Thursday, September 16th. I'm here to give you the update, our Facebook Live 2:30 update on the impact of the COVID-19 pandemic on Mobile County. Before I do that, let me correct one thing that I said way wrong on Monday. And that is that Monday, September 13th, was not my nephew's birthday. It was Tuesday, September 14th. So still, hope you had a great week, Grady. Great birthday week. So today we're reporting a total of 69,781 cases of COVID-19. 191 of those cases were reported to us yesterday. The number of new hospital admissions or people in the hospital who were diagnosed with COVID-19 was 21 yesterday. That's the cumulative number of 8,532. And then 28 additional deaths were reported to us yesterday, many of those going back over the weeks and previous weeks and months. That brings our total number of people who have died with COVID-19 to 1,172. So the daily number of cases reported this week has been quite low. On, Tuesday, 252 were reported, but there was a small backlog that was processed of about 48 records. So if we took those out of the number that were reported on Tuesday, everything this week has been at or under 200 cases per day. That is an enormous reduction in the number of cases reported to us. We're glad to see that. I'm a little befuddled by what all is contributing to that, but we are glad to see the number go down. We'll continue to monitor things closely. The number in the hospital yesterday with COVID-19 was 229. That again is quite low than we had been seeing a few weeks ago. It's still probably 10 times what we had seen on a daily basis in June, but at least we are down and continuing to go down, or the number of people in the hospital continues to go down. That is really good news. A couple of announcements that I want to make, and then there are a couple of questions. From time to time, I get asked about different pieces of information. In fact, someone was asking today about what percent of our cases are in people who are too young to get vaccinated. And if we just look at the past couple of weeks, about 9% of COVID cases reported over the last couple of weeks were in people who are too young to get vaccinated. That is people aged 11 and younger. Another thing about children is that if we look at hospitalizations, again, yesterday there were 229 people in the hospital with COVID. It's been a very steady, 83, 84, 85% of those people are unvaccinated. That has been a very steady statistic. So the overwhelming majority of cases, hospitalizations, and deaths are occurring in unvaccinated. So around 85% of people who are hospitalized are unvaccinated. And when we took a look at the deaths that have occurred this summer, so 174 deaths going back to early July, 91% of them were unvaccinated. So again, just continuing to see this trend that with the Delta variant and low vaccination rates, it is those unvaccinated people getting COVID that are driving hospitalizations and deaths, and it can be avoided if more people would get vaccine. Of the people hospitalized, I found this interesting. We know 9% of our cases are 0 to 11. Around 7% of our hospitalizations are 0 to 11. So still seeing a lot of young people negatively impacted by COVID-19 transmission in our community. And the ways we can stop that is by getting vaccinated, wearing masks, distancing from people that you don't know, staying at home if you're sick, increase ventilation at indoor spaces, avoid large gatherings, all of those things that we've been talking about for some time. All right. couple of other things. Already covered that. A couple of pieces of information out of the state health department. One is we have gotten several weeks, there are some vaccines that are required by state law for child care admission or for admission to K through 12 schools. So there are childhood immunization laws that require some vaccines for children that are they're in child care or in school. For those vaccinations that are required by law, there is an opportunity. People can request a religious or medical exemption from those vaccines. What we are here every once in a while is adults calling us, wanting a religious or medical exemption to get that exemption from the health department for saying that they don't want to get the COVID vaccine. COVID vaccine is not required by law. So we cannot provide a religious or medical exemption letter for anyone of any age for COVID vaccination. So please, no need to call us because we're not able to issue medical or religious exemptions for vaccines that are not required by law. Also, ADPH sent a message, I think late last night or yesterday afternoon, about the change in the way monoclonal antibodies for COVID treatment, prevention of hospitalizations or other severe outcomes, a change in the way those products are going to be allocated. So if you remember, we talked about it last week. The federal government announced that they were going to put monoclonal antibodies on allocation so that antibody treatment can be spread across the United States, because something like 70% of the supply was going to 7 or 8 states that had extremely low vaccination rates, and that didn't seem fair for other people in parts of the country who could benefit from that treatment. So then on Monday, another important and major shift occurred in that the federal government is no longer going to be allocating within the states. So the federal government will decide how much the state of Alabama can receive, what the allocation for the entire state will be, and then the state health department will decide what providers get monoclonal antibody shipments on a weekly basis within the state. So they will look at things like social vulnerability, what we call vaccine deserts, places where there are just not many options to get vaccines, places that maybe don't have hospital care or easy access to urgent care or to hospitalized care, to try to target areas where we can save the most lives with those monoclonal antibody treatments. So the state health department had to really quickly change. So we're just asking all of the providers out there who have requested monoclonal antibody supplies, those allocations will now be approved from the state health department. So please be patient as they stand up those processes. Again, it was just a really sudden change, and I'm sure ADPH is doing their best to adapt to those changes. So I did an interview earlier today that was very interesting. Often we see misinformation about vaccines, about the side effects, about the risks, about COVID on social media, and particularly sometimes it gets a lot of attention when a very popular musician or artist or actor or actress comes out and uses their social media platform to spread misinformation about safety and efficacy of vaccines or about COVID myths and that sort of thing. So please take medical advice from medical professionals. Please don't believe things that are put out by social media stars and starlets. And, please trust experts. Value their opinions when it comes to facts and truths and science and data about COVID and illness and about COVID vaccines. and try not to perpetrate misinformation that is shared on social media by people who have lots of followers but no medical expertise. So I will just stop there with that soapbox. All right, let's see some other questions. Someone asking if you're taking antibiotics, is it okay to get a shot? Yes, it is okay to get any vaccine, whether it's the first, second, or third dose if you're immunocompromised. So it's okay to get your COVID vaccine even if you're taking antibiotics. Then someone was asking about, I've already mentioned this, how many people under 12 get COVID over the last couple of weeks. It's been about 9% of our cases. And then somebody asking about what happened to RSV. This is, again, a respiratory virus that generally afflicts children. We're still seeing it, still seeing RSV out there. Hopefully with kids back in school and hopefully wearing masks, that may slow some of the RSV transmission that we've been seeing this summer when, mostly people were not wearing masks. So it's another side benefit to universal mask wearing in schools, is that it will slow other respiratory viruses from, jumping child to child in those settings. All right, I think I'm going to skip. Go ahead, Mark.
We've got a few here, if you can.
Okay, sure, go ahead.
Okay. What guidelines are in place for those who can't take the vaccine?
So there are very few people who are ineligible to get vaccinated for COVID-19. And really, it's if you have had if you have a severe allergy to any component of the vaccine. That is really the only reason that someone would defer COVID vaccination. It's a very, very safe vaccine. Very few reasons for people to defer vaccination. If you're not eligible to receive the vaccine, if you're allergic to a component, or if you're less than 12 years old, then your best defense is wearing a mask, maintaining distance from people that don't live with you, and staying at home if you're sick, washing your hands, covering your cough. That's your best and only defense. Also, avoid indoor gatherings. And if you are in a school or in a church setting, make sure there's plenty of really good ventilation.
In reference to the religious exemption,
Mm-hmm.
Since it's not a law, then how are the mandates being upheld to get the vaccine?
So the question is, if COVID-19 right now is not required by law, but the president has said that he is going to require it for some situations: federal employees, federal contractors, companies that have 100 employees or more. So those are the president's wishes. That is the president's plan. So a lot has to happen between announcing the plan and those things going into effect. So we are all in kind of a watch and listen mode. There are going to be some guidance. There's going to be some guidance coming out in October, I'm told. It will go out for public comment. The Office of Management and Budget has some work that they have to do before this becomes, a plan that can be put into action. So we are still waiting to find out what it's going to look like when the proposed plan that has been announced gets rolled out to, into operation. So more to come on that.
Do we have time for any more?
Sure.
Why did you seem shocked a few days ago when I stated that I'd had hair loss from COVID?
Yeah, someone saying, why am I surprised that someone stated they had hair loss from COVID? I've not heard that. There is not a body of evidence to suggest that hair loss is related to COVID infection. I'm not saying that that you didn't lose hair because of COVID infection. I'm just saying that it doesn't seem, there's not, there haven't been a lot of enough people to report that it has been associated as a cause and effect relationship with COVID-19 infection. A lot of times when we have an illness, we associate almost anything that happened to us during that time with the illness. And sometimes there are multiple things at play. So again, it's very hair loss and some of the other very rare things that people report as being, something that happened to them while they had COVID-19. I'm not saying that there's not an association. I'm just saying that one has not been shown with a body of evidence. Anything else, Mark?
One last, is it okay to get the vaccine if you had the MTHFR gene mutation?
I have no idea. I'll have to take that one. Someone asking about a gene mutation. I don't know of any gene mutations that would cause you to defer vaccination. There's nothing in the fact sheets on vaccines that say that a gene mutation would be a reason to defer vaccine. So if you're talk to your geneticist or talk to your doctor to explore that further. That sounds like a very individualized question. Okay, so just to remind you that we are still doing walk-in testing and vaccination at 2 locations. Go to mchdcares.com. Our Cox Street location will be open still till 7 on Monday through Friday, open for a few hours on Saturday, but we will not be open on Sunday. So please check mchdcares.com for the latest information on where you can get vaccine and testing through the Mobile County Health Department. And also to remind you that CVS has expanded drive-through testing, and they are using a no cost to the client model. And you get your results. I think you swab yourself and then you get your results in 1 to 2 days. The locations in Mobile are 3100 Dolphin Island Parkway, 4645 Airport Boulevard, and 900 Government Street. So you can get a free test with us. You can get a free test with CVS. So please, if you think you've been exposed, if you've traveled, anything, if you've been, doing things that put you in a higher risk category for catching COVID, please get tested. There's plenty of testing out there available at this time. All right, I'll end there with my remarks. Everybody, please be safe. If you have symptoms of COVID or that you're concerned about, please, it's okay to comment on those at Facebook. Please seek care from a licensed healthcare provider so that those things can get the attention that they need. It's really important. And then also really important to get vaccinated, wear your mask, keep your distance from people who you don't know, avoid gatherings, stay at home if you're sick or if you've been exposed to someone with COVID. And we'll talk to you again on Monday.